Hello, and welcome back to Chagpar MD. I'm Dr. Anise Chagpar. Over the last several videos, we've been talking all about how to maintain your own health, from weight loss to getting enough sleep. Well, this week, I thought we'd look at the workplace. Are there things in your workplace that actually affect your well-being? And to discuss that, I have a very special guest. Khalil Rener is the CEO and founder of Rener Well-being, a company that's really looking at workplace well-being. Thank you so much for joining me.
Pleasure, Anise.
So, Khalil, let's talk a little bit about that. What are the things that you find in the workplace that really can affect people's well-being? And what do you tell managers about how they can improve that?
I think the key for managers is to be able to really, one, look after their own well-being, and two, kind of understand what the needs of their staff are and be able to enable them to work on that.
How do you do that though? I mean, I think that, as you say, in the current crisis, managers, companies are really thinking about the financial well-being of their own industry, right? Many
Yeah.
of them have faced an economic downturn. So, you know, as you say, people are needing to furlough workers, and that certainly doesn't help their well-being. So aside from, trying to maintain your staff, what are the practical things that you can advise for companies to really look after their employees' well-being? I mean, what does that mean exactly?
Right. Yeah. So maybe to give it a bit of a clearer picture, so at Rener Well-being, we kind of approach well-being with a holistic approach. So we look at 4 prongs: so mental health, physical activity, sleep, and nutrition. And really believe that if all four, well, one, that all 4 areas are very interconnected, right? So if you're thinking about your mental health, things like stress, anxiety, that can impact your sleep, which can also impact how motivated you might be for physical activity. So we kind of look at the whole picture. So the way that we do this, if we're supporting an organization to maybe do this at a systemic level, so really making sure that well-being is part of their organizational culture. Firstly, we set the scene. So we'll help organizations to and understand almost what the business case is to well-being. So why it's important to support their staff on not only their happiness and health, but also why it'll also bring productivity benefits, performance benefits. And we found that when working with organizations, I think it's not new, right? That people know that working on their well-being is good for their happiness and health. If any of them have children, I'm sure they're young children, they'll be learning about it at school. But once they understand that, all right, like it's going to help me with my work, and my boss is telling me that I'm allowed to spend the time doing this, it almost starts to enable them to begin looking at it and almost justifying spending the time to look at this. And then we'll kind of carry out a needs analysis or an audit. So some organizations are quite far along their well-being journey already. So they might be putting on regular initiatives. They might have even a well-being specific job or function within their workplace. So somebody's looking after the well-being of the staff. So we'll carry out a needs analysis to understand what's in place and what's already working, what might need a little bit more improvement, but also really understanding what some of the needs of the staff are. We find that a lot of organizations and managers might be very well-meaning with this and go, oh, you know what, we've heard this well-being thing is super important. Let's start doing it, and kind of, finger in the air. What are the big organizations doing around this? And let's kind of copy and paste that within our organization. Sometimes it works, but sometimes you could be spending thousands of dollars on a gym membership for all of your staff, and only 5-10%, if you're lucky, are actually going to be really using this benefit and getting the best out of these benefits. Whereas you could have spent those thousands of dollars around, I don't know, maybe having healthier snacks, or really supporting people to understand how they could sleep better, or have a better relationship with their tech, and have a better work-life balance, so that they're enabling themselves to work on what that is. So that could be a number of things. And then we kind of, from that needs analysis, can then put together essentially a workplace wellbeing strategy to really, could be a series of workshops. It could be a number of different initiatives that are put in place to do that. And you've mentioned managers, and I think it's really important that to note that if this is going to be effective, there needs to be that top-down buy-in, ideally almost at a boardroom level, being spoken about it at a boardroom level, if your CEO and your senior team can kind of buy into this, and it'll trickle down, that's going to be far more effective than if, let's say, whatever, a junior member of staff is going, this is really important, and the managers might not really quite enable that. You could have the best initiatives in the world within that organization, but if the top aren't enabling it and buying in, then that's also less effective.
Yeah,
Yeah, I hope that makes sense.
I think that the whole business case around well-being is really critical, and certainly we've talked about how, for example, sleep improves productivity, and taking care of your health, weight loss will reduce your risk of dying of heart attack and stroke and cancer and all kinds of things that can reduce time away from work. So I think getting companies to really understand that taking care of your staff is really really important, and can actually have, as you say, a business case. Are there numbers around that, Khalil, that you can share?
Yeah.
You implement a program of having healthy snacks in your cafeteria, or you encourage your workers to sleep more, or you get everybody a gym membership, and how does that actually turn into dollars?
Yeah, sure. So yeah, there are quite a few, and looking at the four prongs, I can kind of break those up into the areas. So with mental health, for example, it's the figures of kind of pre-coronavirus, right? But in the UK specifically, there's the Stevenson Pharma paper, which came out in 2017, which was commissioned by the UK government to kind of look at the state of mental health, especially the state of mental health in the workplace. And Deloitte, the consulting firm, did a lot of research around mental health and how that's impacting organizations financially. So a paper came out, an updated paper. So from the 2017 numbers, they have a 2020 report, which shows that on average, mental health issues are costing 1,650 plus pounds per employee per year. But then within some industries, like the finance or insurance industry, that can be around 3,500 pounds per year per employee. So if you think you have 100 staff or 200 staff, that number really racks up quite quickly. And those numbers are kind of based around absence rates, so how much time staff spend off sick, or for a number of reasons, turnover as well. But where the real number comes in, and where the real chunk of this is around this thing called presenteeism, where staff are coming to work, but they're not fully present. They might maybe be coming in because they're sick and feeling pressured to be there, or they're there because they're not quite as focused. And I'm sure all of us and those listening have had a time where they've read the same email or paragraph 3 times because they were thinking about their sick dog or the argument that they had with their partner. And that's where the real bulk is. So around how where mental health issues, either clinical mental health issues, but also low-level mental health issues such as low levels of anxiety and stress. Then with sleep, Rand Europe did a study, and this is from 2016, but 200,000 working days a year in the UK were lost because of a lack of sleep, which is huge. And that's costing the UK around £30 billion a year, which is quite similar to mental health. And the same with nutrition and physical activity. But it's not all doom and gloom, Anise, right? Like, yes, if you're not working on this, the costs can be very high. But if you can put in place effective well-being strategies and interventions that kind of match the needs of your organization, there's a lot of proof that there's a return on investment. So Deloitte found that on average, there's a consistently positive return on investment if you put mental health initiatives in place. And on average, it's 5 to 1. And so within the UK, there are these things called active partnerships. So they're essentially government-run charities or government-funded charities who are tasked to improve the physical activity levels of the population. And it's kind of broken up into 41, I think. And Greater Manchester's one do a lot of work around physical activity in the workplace, and they found that up to a return on investment of 32 to 1 can be seen when supporting your staff to be more active. And again, this is around not only kind of tangible, quantifiable things such as improved performance and improved sales, but it's also improving things such as teamwork, reducing isolation, making staff happier and healthier, reducing absence rates, as well as kind of the seeing it financially. So there's a very big business case, almost to the point where you go, it's almost a no-brainer, really. If you can get this done, it's going to support your business. And really where we approach this is, I want to be focusing on supporting people's happiness and health. And as a lovely byproduct, you get these work benefits. But even if that's where your focus is, then as a byproduct, look, you're having happier and healthier staff. So it's kind of win-win no matter which way you look at it, I think.
Yeah, the other question I have for you is, let's suppose, employers are listening to this video and they think this is just great. How does actually implementing a program kind of translate into people actually doing the work? I mean, I think one of the things that we often find is we can tell people the value of losing weight. We can tell people the value of
Yeah.
looking after their health, of good nutrition and exercise and sleep and stress reduction and mental health and all of these
Mm.
things. But it's really hard sometimes to actually do the things that are good for you. So how do you help do that?
Yeah, again, lots of different ways. So as an organization, we kind of break it down into three main services and kind of ways in which we support organizations. And one is kind of this well-being strategy piece, which I mentioned, right? So you go in and analyze what the needs are and really come up with these bespoke approaches and interventions. And then kind of measure that over time. And I can go into those in more detail. But then we also have workshops that we run. So they can be awareness workshops, can be educational, but also by really giving very practical tools that individuals can implement into their lives and giving them takeaways, as well as then one-to-one support. So within Rener Well-being, we really have a focus on making sure that anything that we're putting in place isn't necessarily tick boxy, because it's quite easy to do that, right? We've had this stress workshop in, so tick, we've solved stress for our organization. But really wanting to make sure that any of the takeaways that are gained are immediately implementable, but also adaptable and sustainable, right? Like, let's say December time, if we ran a stress workshop for somebody, for an organization, and then coronavirus happened, like hopefully they're able to now take the tools that we gave them and shape them to then meet their current needs. So in short, if employers are starting to look at this and go, right, where do we even start? Step one, I would say, is to raise awareness around the workplace. So to kind of make sure that everybody understands that what workplace well-being is, and that, because there's kind of a lot of misconceptions, right? One, they're going to make us become yoga gurus and marathon runners and have to, never have cake again, right the way through to this is solely so that they can squeeze the most out of us and, make us as productive as possible. And to go, this, if it's coming from a place of good intention, that, we're here and we're putting these initiatives on because we genuinely want to support you and your well-being. We know that it's important. It's a nice thing that we want to do. And two then is asking what is needed. Like it's such a clear kind of commonsensical thing to say, but you'd be surprised at how many organizations miss that. And so to do that as an employer as well, there's kind of this put your air mask or your oxygen mask on first analogy as well. So if you're a manager or you're an employer and going, okay, right, I really actually care about my team and I want to support them and it's a tough time, so let me try and do everything for them. The most important thing is to look after your own well-being first so that you can support others. So looking at not missing that step out. Then once you understand what there is, then it's kind of easier to go, okay, right, the real issue is stress, or the real issue is that my staff just don't have the time to be physically active, or don't know what healthy nutrition looks like, or clearly everybody's working until 11, 12 p.m. So we need to work on a way of improving work-life balance. Then it's quite easy to kind of find the workshops or the one-to-ones or the policies in place that are needed. On that point, and sorry, Anita.
No, please. Yeah.
I was going to say on that point though, it's interesting. So one startup that we worked with already had a flexible working policy in place, right? Because this is going to be really good for our employees' well-being, and we know that they've kind of highlighted that running a flexible workplace is good in theory, and actually in the end it caused more anxiety. Right? They were running this, and we came in after they'd already implemented this. or when we were interviewing staff to see what was working, because some people would come in at 7 a.m. right and go, right, I want to start early and finish early so that I can go pick up my children, and wonderful. So then people are seeing that others are coming into the office at 7, and some people are leaving at 8 or 9. And so it slowly caused a lot of presenteeism, essentially, where there were staff that were coming in and easing out and slowing down their tasks so that they could make their work last from 7 till 9 p.m. and feeling like they always had to be on. And then others would always be sending emails at kind of midnight because that was the only time that they could, which then caused other people to feel like they had to reply, etc. So even once you go, okay, right, clearly the right thing is to carry out a flexible working policy and change that, it's still really important to understand that there are different ways in which you can implement these, and to do it in the right way that works for your staff, and that internal communication is so important, because you can have a flexible working policy that could do the opposite of what you were hoping it to do.
Yeah, no, absolutely. And on that point, have you found that, now that we're in this COVID pandemic and a lot of people are working from home, is that improving workplace well-being in the sense that people have more flexibility to kind of manage things as they want? They're spending less time in traffic, which might help with their mental health. Or are you finding the opposite, that, people really need the structure of the workplace, that being home when they're, homeschooling their kids gets to be very stressful as well? How does working from home really play into people's well-being?
Again, I think it really depends, Anise. Really depends on who you are, what your situation is at home. Kind of to answer your question more from kind of the conversations I've had with clients, I think those with children have found it a little bit harder from time to time because they're having to homeschool. They might not have been able to get the external help in that they would have done before because of having to have that social distancing in place. For others, they really miss it if they're alone in an apartment in the city. They really do feel isolated and not having the garden or nature to be able to go out to. But then others who've kind of really been fortunate to have a nice situation at home, I think going, what was the point in an office in the first place? This is the best thing ever, and are actually becoming more and more stressed as they're beginning to have to return to work. And like one person I was speaking to, she was able to now find time in her day to be physically active because her commute was out. So she was using her commuting time to be physically active. So I think it really depends. And again, with any organization and with anything like this, it's a bit of an annoying answer, I think. I know, to say it depends, but you've really got to look at the individual, and everybody has different needs, different situations, different aims. And so as an employer or even as an individual, I think it's important to be aware of what's working for yourself and what's working for your team, and how you can kind of make that work.
So workplace culture certainly makes a big difference in terms of taking care of people's well-being, and there certainly is a business case to be made for looking after yourself as well as your employees. Khalil, this has been a great video. Thank you so much for joining me today on Chagpar MD. Again, for anybody who's out there who wants to get a hold of Khalil, I'll leave a link in the description box below. Please do, if this video has been helpful to you in thinking about your own workplace or your own well-being, send me a message, like, share this video, and please do hit subscribe. Let me know what other topics you'd like covered, and I will see you next week. Until then, this is Dr. Anise Chagpar wishing you all a healthy and safe week.